thing I want to talk about is cosmetic dentistry. What is cosmetic dentistry? Cosmetic dentistry is a procedure that includes many dental procedures like teeth whitening, crowns, veneers, fillings. All of that include under the name cosmetic dentistry. Usually the patient come to our clinic and they complain about they don't have nice smile. They don't like to smile like, or they smile like many people. They came to our clinic and they complain about their smile, or their teeth are not aligned well, or they hesitate to smile in the public. So usually what we do is what we call smile analysis. Smile analysis that we try to discover or diagnose what is the problem. Sometimes minor correction in the teeth will solve the problem. If the teeth are not properly aligned well, sometimes just alignment of 1 or 2 teeth will solve the problem, and you can smile very nice and you will have very attractive smile. How we can do that? First, we make pictures, models, and x-rays, and we do smile analysis. Smile analysis, that's mean the level of the gum. Usually in the ideal smile, the teeth must be well aligned so that the central incisors 2 mm or 1.5 mm longer than the lateral incisor, and the lateral incisor is shorter than the central incisor and the adjacent canine. The canine and the central incisor must have the same length. For some people, we need to do longer incisor teeth to show 2 mm under the upper lip when they smile. That gives them more youthy look. And not only the level of the tooth from the incisal border is important, but the level of the tooth from the gum part also is important. Some people, because they have the level of the central incisors up and down and the level of the lateral incisor up and down, when they smile it looks not nice. So what we need to do is a simple correction to the gum with laser or with surgery, and that will give very nice. And sometimes some people, they have the problem in their gum. So when the gum level of the teeth or the front teeth is not balanced, also will not give them nice smile. If the central incisors are much higher than the lateral incisors or than the canine, or the lateral incisors have the same level of the central incisor, also their smile will not look nice. So what we do is a simple correction of the gum with a simple procedure, what we call a gingivoplasty. That means plastic correction to the gum. Smile makeover includes all those procedures in addition to the porcelain veneers. Porcelain veneers is a very thin shell of porcelain, like the contact lens. The thickness of this shell is 0.3 to 0.5 millimeter. This shell, we make an impression or mold to the patient's teeth, and then we send this mold to the lab. In the lab, we'll do the smile analysis. The smile analysis that we're trying to create the ideal smile to the patient that would match the face outline, the color of the eyes, the color of the skin, and all that will be all together to choose the design of the smile to the patient. After that, we took those veneers and we cement them on the front surface of the teeth without touching the front surface of the teeth. There is another method also to create those veneers, that we remove a little amount of the tooth structure. We do that because of the tooth has non-favorable position. If the teeth are malaligned, crooked, or if the teeth are malaligned, crooked, or heavily discolored, we have to remove part of the tooth. Other than the tooth, if we just stick the veneer on the top of the tooth, it will look bulky and the smile will not look nice. So what we do is just to remove 0.5 millimeter of the enamel only. Again, from the enamel only. That's mean only from the outer layer of the tooth. we will not reach the dentine. So that we remove only 0.5 millimeter from the enamel only. And again, from the enamel only, that's mean only from the outer surface of the tooth. That will not affect the strength of the tooth in any way. And then we prepare the tooth to be in a well-aligned position, and then we make an impression and send to the lab, and the lab will create those thin shells. We'll choose the shade together. Some patients, they prefer to have very white shade. That's their choice. And some patients, they want to have just natural looking shades like their teeth. Then we go together to the lab and we'll choose the shade of the teeth that you want to have on your teeth. Some people, they like to have very light shade, very white shade. And some people, they have natural looking shade. The best shade that suits the patient is the shade that match with the face and the color of the eye. And when you smile in the public, will not look natural and will not reflect too much light. That's mean the more natural shade is the shade that match you or suit you more and match with what you have from your teeth. But there is one important point I want to mention here, that porcelain veneers will correct the position of the tooth from the front surface only, but we will not move the tooth. I mean, if the tooth is severely malaligned or it take a position different than the normal position, we cannot correct that with porcelain veneers. Now we need to think about another treatment, that is the orthodontic treatment, which is integral part of the smile makeover. Some people, we cannot create them new smile without doing orthodontic treatment. Orthodontic treatment to move the teeth in the proper position is very important before having veneers. In addition to teeth whitening, there is gum whitening. Many patients, because of smoking, they got their gums darkly stained and they don't like to smile with such dark color of the gum. This is simply, we can do it with two ways, either by surgical procedure or more safely by laser. Simply by using diode laser, we can resurface the gum and get a new color of the gum. Simply by using diode laser, we can remove the outer stain from the gum and then get back the normal pink color of the gum. Cosmetic dentistry also include, in addition to veneers and orthodontic treatment, it also include treatment to the back teeth. So changing the amalgam fillings to white fillings is also part of the cosmetic dentistry. Now, 3 countries in the world, they stopped using amalgam fillings as a filling material. That is Germany, Sweden, and Canada. So instead of using, due to toxicity of mercury. So in our clinic also, we change those fillings if the patients require, or in our clinic also, we change those fillings on the patient request. The amalgam filling can be changed to composite white filling, that is the ordinary white filling that we use daily, okay? And or we can change it with ceramic filling. The new era on ceramic filling, what we call it the CAD/CAM system. The CAD/CAM system, that is fillings that created or designed especially for your tooth. That's mean we prepare the cavity and then now we can change the amalgam filling with the ceramic filling, what we call it the ceramic inlay or onlays. When we use the inlay and when we use the onlay, it depends on the size of the cavity and depends on the size of the filling that you have on your tooth. So what we need to do is to remove the amalgam filling. We remove in each visit 1 filling. And the second visit, we can remove the other fillings if you have more than 1 filling. And prepare the cavity, make an impression, we send the impression to the lab and the lab will prepare. Actually, it's the computer designed filling. The computer will prepare those fillings specially for your tooth. So we take this filling, it will be the same color of your teeth, and we stick it in your cavity. It is very nice filling and it's more durable than the composite filling. One more thing I want to mention here, that if you are pregnant, so we are so sorry, we cannot change this filling for you. You have to wait until you deliver, and then we can come and change this filling for you, because it is too dangerous to change the amalgam filling while you are pregnant. One more thing that many people complain about is gummy smile. What I mean, or what's the meaning of gummy smile? Gummy smile means that a lot of the gum show when you are smile, and it is not nice, because natural smile, it should not show the gum, it should show only the teeth, and the upper part of the teeth must be covered by the lip. The cause of this problem, actually, it's multifactorial. I'm not going to talk about how it happened, but I'm going to talk how we can solve it. Some cases we can solve it very simply with only simple surgical correction to the gum. We remove the extra gum and then we'll let the gum heal, and it will show very nice smile after healing. We get rid of that gummy smile. For some other people that have too much bone also in addition to the gum, we need to do simple surgical procedure from the canine to canine, or sometimes from the first premolar to the first premolar, and we remove that bone in addition to the gum. After that, also either leave the healing take place, or we can restore the teeth also with ceramic veneers, because sometimes we need to shorten the teeth to balance. Because sometimes we have to shorten the teeth to balance the length of the gum. That means the amount that we removed from the top, we need to balance and remove a little amount from the incisal edge of the teeth. For other people, the treatment may be more complicated and takes longer time and need a lot of patience. Like, for some people, the problem happen because their upper jaw is much more lower than the lower jaw. That means we need to do a correction, like orthodontic treatment, to solve the problem, in addition to jaw surgery. The jaw surgery must be in the last stage. The jaw surgery should not be done before correction, the teeth alignment, and the teeth alignment must be in the normal bite, or what we call it, the normal occlusion. After that, after correction, the bite and correction of the jaws, we can go back to the teeth and restore them, either with ceramic crowns or with ceramic veneers. Gummy smile, some people also, they do that, they put Botox to the upper lip to remove. Some other patient or some doctors, they prefer to add Botox to the upper lip so that preventing the upper lip from going up too much. Actually, we can do that, but it's better to work on the teeth, because the teeth and the jawbone are the cause of this problem. Bad breath. What is bad breath? Many people, they complain that when they wake up in the morning, they have bad smell in their mouth, and they can smell it. Many people, they cannot smell it. This problem will not be, some people, they don't know that they have this problem until somebody else, they dare and come to tell them that they have this problem. And it is totally embarrassing thing to have this bad smell in your mouth, and you don't know what to do to solve it, and even you don't like to talk to other people, or you stay away from or you stay away from other people because you have this problem. Bad smell happen in your mouth because of two reasons. The first reason, what we call it local. That means in your mouth. Like you did not clean your teeth for a long time. I mean, not clean your teeth in home, but you clean your teeth in the office. You should clean your teeth every 6 months to remove that calculus, or what you call it, the hard deposit that accumulate on the back surface of the teeth. Also to remove that, what you call it, the calculus that accumulate under the gum. The main problem of bad breath. The second thing, you need also to brush your tongue, because this problem happens because many of bacteria and remnant of foods and plaque accumulate on the back of your tongue. So not only brush your teeth, but also brush your tongue. Or maybe you have bad prosthesis, like an old crown or old bridge, or an old prosthesis in your mouth that now need to be changed and become loose. Bad smell has two reasons. The first reason is local. That's mean in the mouth. First of all, we need to check the calculus. That's mean the hard deposit that accumulate on the back surface of the teeth. If you have this calculus and if you have too much plaque, that will cause you this problem. What you need to do is to clean your teeth regularly every 6 months in the dental clinic, so that you remove that. You cannot remove that calculus by normal cleaning or brushing, and you cannot avoid it because it's normal reaction of your food, the reaction of saliva with your food. So you cannot avoid this calculus. So what you have to do is to clean your teeth regularly at the dental office. And what you need to do is to clean also your tongue. When you brush your teeth daily, not only clean your teeth, but also clean the back of your tongue. Many dental brushes now, they have the back surface, what we call it the tongue brusher. So brush your tongue, rinse your mouth daily, and you can avoid this problem. If not, so maybe it's another reason. Another reason, if you have a lot of cavities in the mouth, also it may cause you that bad smell. Poor crown or bridge, or old crown and bridge, that will cause a lot of bacteria to go inside and cause you that smell. Some old crowns are manufactured from poor metal that react also with the gum, with the saliva, and cause you this bad smell. If everything is okay, nothing, there is no local factor, now we need to look for another factor that may cause you this problem. One of the major cause of this problem is the systemic or the medical problems or medical disease, like diabetes. Diabetes is one of the major cause of this problem, that when you have a lot of sugar in your blood, that you start to smell the ketone smell or the fruit smell in your mouth. So when you have this smell and you don't know that you have diabetic, you have to go and check your blood. So that if you have this fruit smell in your mouth and you don't know that you have a medical problem, you need to go and see your physician. One more problem that causes this problem also, a kidney problem or stomach problem. If you have also poor digestion in stomach, if you have also, one more cause of this problem is kidney problem. One more cause of this problem is kidney problem and stomach problem. First of all, we look to the local factors. After we remove those local factors, we look to the systemic factors. One more thing, many toothpaste and mouthwashes in the market, they have materials that cause also bad smell. So what you need to do, when we are treating or when you are complaining of bad smell, is to know what type of toothpaste you choose and what type of mouthwash. It should be a special mouthwash, alcohol free. Alcohol will cause bad smell in the mouth. One more thing, the toothpaste must be specialized for bad smell and devoid a certain material that cause that bad smell in the mouth. One more thing, you can also use the refreshener like mints, chewing gums that have mints also, that give you a fresh breath in the mouth.